Heart failure is a major health problem. It is a highly prevalent disease and affects 15 million with global prevalence of 1 to 2%, but can reach 10% in elderly patients. It is associated with high morbidity and mortality and major use of resources. Heart failure is a progressive disease. It starts with risk factors and evolves to left and right ventricular dysfunction, compensated heart failure, then decompensated heart failure, and together with that, patient will experience reduced quality of life, increased symptoms, and overall mortality is increasing over time. Challenges diagnosing a patient suspected with heart failure. There are two different clinical pictures of heart failure. Acute heart failure, in which the main challenge is its accurate and rapid diagnosis, and chronic heart failure, in which its greatest challenge is correct management. Challenges are enormous in emergency department for physicians during the early golden hour of patient with acute heart failure. Diagnostic tools for an accurate diagnosis and a quick triage are a necessary aid. Biomarkers such as natriuretic peptides-based quick diagnosis and rapid triage approach has been widely accepted and incorporated in most clinical guidelines for managing heart failure. Natriuretic peptides are neurohormones involved in fluid balance in vascular hemostasis. Their level increases in case of overload of left and right ventricles. Natriuretic peptides are markers of heart failure and myocardial strain and are synthesized by the ventricular myocardial cells. In the myocardial cell, they are synthesized from precursor pre-NT-proBNP, cleaved into proBNP, the active hormone, and NT-proBNP, the N-terminal fragment. Due to analytical differences and renal clearance, the concentration differs, and we cannot translate one marker to another. Use of NT-proBNP with heart failure patients. Measurements of natriuretic peptides are used for rule-out or rule-in acute or chronic heart failure. Also used in confirming diagnosis of heart failure with preserved and mildly reduced ejection fraction in conjunction with echocardiography. It should also be used for prognosis assessment, and lastly, it can be used for guided therapy. NT-proBNP is also used in patients at high risk, such as diabetic patients, patients under chemotherapy, patients for surgery, etc., for LV dysfunction. Dynamics of NT-proBNP and their clinical relevance. Patient may show different concentrations of NT-proBNP in different clinical conditions. In acute onset of heart failure, NT-proBNP reaches at high concentrations that's also proportionate to the severity of disease. Diagnosing using higher level of threshold value is necessary in such situations. Heart failure is very unlikely when less than 300 picogram per milliliter of NT-proBNP is measured. Higher value than the threshold concentration indicates probability of heart failure. For patients with non-acute onset, NT-proBNP has mild or moderate elevation. Thus, the use of NT-proBNP for both diagnosis and prognosis should be based on threshold set differently. Heart failure is unlikely when value is below than less than 125 picograms per milliliter, and the value is higher than this lower threshold. Heart failure is suggestive, but additional testing is required before diagnosis. For patients with acute onset, age-adjusted cutoff can be used. Patients of less than 50 years, the value NT-proBNP 450 picogram per milliliter or higher is considered for inclusion of heart failure. Patient between 50 to 75 years old, the recommended threshold is 900 picogram per milliliter. And for patients above 75 years old, 1,800 picograms per milliliter of NT-proBNP value is considered for heart failure. For patients with suspected chronic heart failure, the European Society of Cardiology recommend only one threshold value at 125 picogram per milliliter. But for patients above 75 years old, the use threshold value of 450 picograms per milliliter would increase the ppv. Impact on patient management and outcome. 1. NT-proBNP to guide quicker decisions which translate into better patient management. 2. It can have a positive impact on bed management and improve patient outcome. Patient management improvement using NT-proBNP is associated with a decrease in healthcare-related cost, hence can save on hospital resources.